Everybody. For those that don't know me, I am Lucy Hunte, National Programme Manager for Apprenticeships at Health Education England, and HE are mandated by Department of Health and Social Care to support the development and implementation of apprenticeships across the NHS. I'm also recently become a trustee of the board of NOCN. So I've been asked to kind of speak to you today about how we can maximise the positive publicity that we've achieved through the pandemic. So I'm going to give you some thoughts on that. The past couple of years have been unprecedented and challenging, but the national appreciation shown towards the NHS has certainly helped keep morale up. Unlike many sectors, we were open throughout the pandemic and in fact busier than ever, with our highest ever number of apprenticeship starts. 24,000 starts during a pandemic is no mean feat and testament to the hard work of the employers we support and the training providers, universities and EPAOs we work with. HEE worked at pace to switch to virtual delivery and ensure minimal disruption for our apprentices. Rather than mass breaks in learning, we worked with providers to look at the exposure they were receiving in different environments as a learning opportunity. We worked with IFA on exemptions and flexibilities to ensure apprentices were able to achieve and were released to support the frontline effort. In February 2020, the majority of non-clinical staff switched to virtual working, and getting the tech to work behind the NHS firewalls was a monumental effort, but we still continue to recruit and onboard new apprentices. One of the benefits of the new virtual world was that we had increased access to students interested in careers in the NHS. With lockdowns and no school, they were literally a captive audience. We no longer only had access to the young people schools did not want to stand for A-levels, and we've engaged with thousands of young people who would previously not have considered a career in the NHS. In 2021-22, there were 90 different apprenticeship standards being utilised across the NHS, and we could showcase the career pathways available via the apprenticeship route from level 2 to level 7. Everyone we engaged with had no idea about the opportunities available, and the lack of impartial careers advice and guidance was evident. There is still the perception of many that apprenticeships are still only for the trades or hairdressing or for those less academic. And while schools are competing to retain their students and the funding attached, I believe they will never fully be discussing all progressions and destinations equally. Many teachers who attended our virtual events have commented they have learnt just as much as their students. When people think of roles in the NHS, they will obviously think of doctors and nurses and clinical roles, but each trust has huge back office functions such as IT, digital and data, HR and people professions, and estates and facilities. Post-COVID, we are working with NHS England and NHS Digital to look at their workforce needs and increase the uptake of apprenticeships in these equally essential roles. Also, as the biggest employer in England, employing over 1.3 million people, the NHS is often the largest employer in any city, but we know people would not necessarily consider us as an employer of choice. One trust could employ over 10,000 people across numerous sites, so the career opportunities are endless. Work experience has obviously been a challenge during the pandemic, but the HEE Widening Participation and Access team worked incredibly hard to develop a virtual work experience repository to ensure the future talent pipeline was not impacted and young people could still gain these vital insights into careers they were considering. As you're probably aware, the cost of living crisis has further exacerbated the need for a decent living wage for all, and many workers made redundant from retail or hospitality have been able to utilise their transferable skills and start careers in the NHS. We do have some challenges now competing on salary with supermarkets, for example, on our entry-level roles, but with the use of career pathways, we can show the opportunities for development and the progression and the earning potentials. HE have been instrumental in the development of the medical doctor apprenticeship, which is awaiting ministerial sign-off, and we hope this exciting new standard will support our aim of widening participation and supporting social mobility for those from less privileged backgrounds. The academic requirements will be just as stringent, but with a salary and the first stage of their doctor's education funded via the apprenticeship levy, we hope some of the financial burden will be removed. It is essential that our workforce represents the increasingly multicultural communities we serve, and one of the main barriers to this is the recognition of prior learning and international equivalencies. Apprenticeships are a fantastic opportunity to attract new recruits to the NHS, but also to upskill our existing workforce. The very first cohorts of registered nurse apprentices were actually healthcare support workers who would never have been able to afford giving up work to go back to university, but via the degree apprenticeship route have been supported to achieve their dreams. This has not been without its challenges, as many universities were slow to adapt their entry requirements to reflect the extensive experiential on-the-job learning that these learners would bring with them. HEE have commissioned Middlesex University to work with us on the standardisation of recognition of prior learning and progression from level 3, which we believe will help to remove some of these barriers. So what are the current healthcare skills demanded for new and existing workers? They are similar, I assume, to many sectors, and all roles require a good level of maths, English and digital skills. There is increased use of technology and data, and the move to electronic patient records has been a huge undertaking and transition for the NHS. We hope with the increased focus on traineeships and programmes such as Prince's Trust, we can support those young people furthest from the job market into careers, and we are keen to access initiatives from DfE such as Multiply and Skills Boots Camps. We will continue to lobby our fate for a level 2 business administration apprenticeship, as the removal of this and other vital first rungs on the ladder cannot be unrelated to the decline in level 2 starts. With the increased focus on apprenticeship and skills and more initial assessments taking place, it is evident that maths and English attainment is still an issue. A worrying proportion of applicants have a hidden learning need that was never identified in school, and interventions are needed to ensure these learners are not left behind. HEE have funded access to BKSB initial assessments and diagnostics for the whole of health and social care, so employers are able to assess and signpost their learners to the correct programmes. Maths anxiety is a key issue, and we work with national numeracy to utilise their resources, and also have an English as a second language ESOL network to share best practice. The use of AI will be a game changer in future years, and many of the skills needed for the current workforce will evolve or be replaced. There have certainly been some innovative developments in the way we work during the pandemic, and as we start to return to the new normal, there will be many of these we are keen to retain. Virtual working is not only better for a work-life balance, but for benefits for the environment with reduced travel cannot be overlooked. There will be a review of our office spaces and external venues needed, and while face-to-face meetings and events will return, I envisage we will be much more prudent in these choices. In my team alone, the cost of savings have been huge, but we have been just as effective and accessible, if not more so. So in summary, I'm incredibly proud of all we've achieved in the last couple of years and look forward to what the future holds as we continue to go from strength to strength and build the skills of our workforce. I hope you enjoy the rest of this Health and Social Care Summit. There are some great sessions coming up from NOCN colleagues covering the wide range of support they can offer. Thank you.